Hi, so I'm going to be discussing the four databases described in our text. The first is the PCV, which is a packed cell volume, and it's made up of whole blood cells that are made up of red blood cells, and usually a low PCV indicates renal failure, autoimmune parasites, or trauma, and an increased PCV usually indicates dehydration. And how we check for the PCV is we use a hematocrit tube and a tube sealant to stop the end once the blood is in it, and then a centrifuge that we spin the blood down, and then a hematocrit tube reader that will read the percentage when we're finished. The next one is total solids and total proteins, which is TS or TP. And it just measures the plasma protein levels in the animal's blood, and there are three of them. They're albumin, globulin, and fibrinogen. An easy way to read this is we just have the strips in the hospital that we can put into our blood machine, and it kind of spits it out for us. Usually an increase in these equals dehydration or infections, and then a decrease is sometimes inadequate production or blood loss, intake, and so the normal reading for a dog would be 5.5 to 7.5, and a normal reading for a cat would be 6.5 to 8.2. And how you read this is you use the refractometer that you would use for a urinalysis, and you would break the hematocrit tube and put the serum on there, and that's how you would read that. The third one is a blood glucose, and the blood glucose is read usually by a glucometer with a glucometer strip, and you use a little fresh drop of blood on that, and that's going to give you your reading right away. And it's important to read the blood as soon as you put it on there, as opposed to letting the blood wait, because that's going to affect the levels. Usually eating a lot increases the blood glucose, and fasting decreases the blood glucose. And also the stress levels of the blood glucose elevates the levels. And for a dog, a normal is 80 to 130, and for a cat, normal is usually 70 to about 180. And if we get anything that's less than 40, it usually indicates a problem such as hypoglycemia, and that can be fixed by the doctor. And so then our last one is BUN, which is blood urea nitrogen. And once again, these results can also be read on our blood machine in the hospital. Just put them in the machine and it reads them out for us. And this BUN is actually the kidney's ability to get rid of waste from the blood. And what is involved in this test is we have a reagent strip with whole blood that we put on there and water, and then once you do all that, it's going to give a reading to see how the BUN is working to remove the waste from the body. And if you get anywhere between 5 and 35 for a cat and a dog, that's kind of normal production. So some additional databases that I didn't discuss are parasite checks, such as a fecal, radiographs for ultrasounds, urinalysis, EKG, blood work. Those are some additional tests that we may need to do other than the ones I just discussed. And then the needed tests that we would do for like a geriatric patient or a sick patient would definitely be blood work. We would do a CBC, a GHP and lights, most definitely, and then radiographs, usually a lateral, and VD of an abdomen and chest. They are most definitely the first two things we would tackle. If we don't find anything from that, then we would continue on with like an ultrasound, or we would get a urinalysis, do a parasite check. Those are some things that we would do just to rule some things out, especially with a geriatric or a sick patient. And then also for surgery, a protocol for surgery that my preceptor and I have discussed. The drugs we would use are Demeter, Torb, and ketamine. and we use all three of those together, and they are both good for a dog and a cat. They provide anesthesia as well as a little bit of pain control, and they don't usually make an animal sick, such as hydromorphone that makes an animal a little bit sick. So the Dominor Torb-ketamine is a safe, easy protocol that we use for patients that are being anesthetized for surgery, and we will follow that with propofol to induce for surgery.